Hello, my name is Roth. I'm 18 years old and I live in Atlanta. Tomorrow I'm getting the Ravitch procedure to repair my Pectus Excavatum. I'm getting it done at Eggleston Hospital with Emory University, and the leading surgeon is Dr. Ricketts, who's the head of thoracic surgery there. So I'm confident in his abilities. I'm getting the Ravitch procedure, which is the open approach, versus the Nuss, which is the less invasive way. The Ravitch is, in my case, better because it's used for when the chest is uneven, and you might be able to see my sternum is off level, and my protrusions of cartilage. This one is much pointier and pokes out more. With the Ravitch also, you can pull it open and shave back the cartilage better. In the Ravitch, they cut you open from the top, 4 to 5 inch incision, and then remove your sternum, or remove the cartilage from your sternum, and then shave back the cartilage, which are envelopes, and there's cartilage on the inside. They cut it open and then shave out the cartilage, and then sew it back with stitches that will dissolve eventually. And then with Ravitch versus Nuss, the Ravitch has a smaller little strip that goes like this, goes outside the rib cage and then supports the sternum from the underside once it's put in place. And the Nuss has a bar that goes all the way across. And also with the Ravitch, you need to have a drain because there's the airspace under your sternum afterwards that fills up with fluids, and the drain sucks up the fluids and also creates suction inside of the air, the dead space they call it. That pulls the muscle and meat into place under your sternum. I'll be in the hospital for 5 to 7 days, they say. Could be more, could be less, depends on my rate of healing. They give you a morphine epidural through the spine, in my case, so it numbs your torso. I'll also have IVs for stuff like that, and a catheter, because with the morphine you don't know if your bladder will be paralyzed or not while you're on the morphine, so they just give you catheters in case. And then after a few days they remove the drain, maybe multiple drains depending on how surgery goes. Once I'm home, they give you a prescription of narcotics that then you decrease to Tylenol, they say. So I don't know how that'll go until that happens. Heal rates usually vary from subject to subject, so I hope I'm not still in pain when I go off to college, because I waited till after graduation for the surgery so I wouldn't be missing any class, which was back in May. It is now Wednesday, about 1 a.m., and my surgery, I'm leaving at 7, so I should probably get to bed. I'll get back to you and put up some more footage after the surgery, so I'll see. I guess that I'll probably be pretty drugged up at that point, but we'll see. I just wanted to get a pre-op video so I can see the difference later on. It's pretty deep. They said it was like a 2.7 centimeter depression back in January, so I don't know if it's grown anymore. I haven't checked. I got tests run for it. For the insurance purposes, I had an EKG, cardiopulmonary test, and a CAT scan. So as far as those go, they help you off with insurance in case you find any deficiencies. Like I have a pulmonary deficiency, they say, so I can only fill up 70% or so of full capacity. And also when I'm lying down or sitting down on the sofa or something, or in a desk at school, and I get up too quickly, I can get lightheaded and fall over. I've even passed out and knocked my head on stuff before, but I can usually, it wasn't until recently that I was able to match it up with Pectus Excavatum. And sometimes, whenever I'm running, maybe after a mile and a half, I physically have to stop or else I'll pass out of shortness of breath. And like if I'm running upstairs or something, I don't want to call it just being out of shape, but I seem to get have a shortened breath more quickly than my classmates, I guess. So we'll see how that goes after the repair tomorrow. I guess today. I'm not really too nervous. I'm confident in my doctor's abilities, and I'll see you later. Wish me luck. Take care.